Welcome back, everyone. Helping solve behavior problems in children, that's the goal of a new clinic at UF Health. Now, the aim is to help curb disruptive behaviors by helping parents and children in therapy. Now, according to the CDC, 1 in 6 children between ages 2 to 8 have a diagnosed mental or behavioral disorder. Now, behavioral disorders can be reliably diagnosed at age 3 and can be treated effectively when treated early. That is so important. So joining me this morning are Courtney Schroeder, a psychologist and assistant professor of child and adolescent psychiatry, and also Britney Duner, a licensed clinical social worker. We appreciate you ladies for being here to talk about this.
Thanks for having us.
Thank you so much.
Absolutely. And as we just saw, 1 in 6 children have behavior problems. So what kind of effects can it have on their overall health and development?
That's a great question. So it can definitely impact them long term in the sense that they have more likely to have lower academic achievement, higher dropout rates of school, more likely to be delinquency, higher rates of crime can be the long-term effects of behavior disorders with children.
And is that something that you've seen as well?
Yes. And I would say we've even seen an uptick in diagnoses with children, especially things like ADHD, autism, oppositional defiant disorder.
Oh my gosh, that's why it's so important for parents to know and to be aware and to take action. So can we talk about something called PCIT, make sure I have it right,
Yeah.
Parent-Child Interaction Therapy. Exactly what is it? How does it work?
Yeah, parent-child interaction therapy, we call it PCIT for short. It is an evidence-based treatment treating children who are displaying behavior problems ages about 2.5 to 7. And when I say behavior problems, I mean like hitting, biting, scratching, kicking, talking back, whining, things like that. And when I say evidence-based, I mean where this has been tested with thousands of kiddos in thousands of different places to show that it is effective with these kids, and it works.
Mm-hmm. Yeah, so parent-child interaction therapy, really the overarching goal is to improve the relationship between a parent or caregiver and their child. So we do this through coaching sessions where parents are using really consistent and positive strategies to interact with their child, and we see an improvement in overall child behavior. So we're seeing an increase in more positive behaviors like listening, taking turns, following directions, and then a decrease in those more negative behaviors, things like aggression, destructive behaviors, yelling, tantruming. And so parents are really taught to use consistent positive parenting skills as well as discipline strategies instead of more punitive strategies so that they can manage their child's behavior but then also maintain that warmth in their relationship.
See, I'm a parent, so what I'm hearing right now is trust a factor of this?
Yes. Yeah, so at this point with kids with behavior disorders, there's usually a lot of frustration and stress and a lack of trust because the children are not complying with what the parent is telling them to do. And so we have 2 phases of treatment where that first phase is to rebuild that trust, rebuild their relationship, strengthen it through lots of play therapy skills and we modify their behavior with behavior management skills as well. And then in that second phase, we teach parents, once that trust and foundation has been set, some discipline in a positive, consistent way.
Let's also talk about the clinic and how can people get started and how can they learn new information about it?
Yeah, at our clinic we have a state-of-the-art setup with a playroom. This therapy is done with coaching sessions. We do bug in the ear to give parents live feedback when interacting with their child and using these skills. And there's this one-way mirror where the therapist observes the child and the parent while they're having fun together and to teach them those skills. And setting up through our clinic, the therapy is weekly for 1 hour with 5 minutes of practice at home. And the sessions are about 16 to 20 weeks. And you can call UF Health Psychiatry San Jose to schedule an intake to see if you meet criteria and eligibility for this treatment.
Yeah. Excellent. Is there anything I'm missing? Anything you want to wrap up with or say about this and the effects that it has?
So we've seen pretty immediate positive effects with the kids that we work with, and we're both moms as well and use these skills at home with our kids, and it's really great to see just the development of that secure attachment and relationship strengthen and develop between kids and their parents, and then really just seeing the how much more confident parents feel in their relationship and their ability to manage their child's behavior.
I was going to say, this is ringing real true to home for me. Ladies, we appreciate your time. Thank you so much.
Yeah, thank you.